My name is Sally Williams. I'm a health policy consultant. I was commissioned by the RCVS to undertake research as part of its first-rate regulator initiative. So the aim of this research was to sort of do a 360-degree appraisal of the RCVS. So to understand from different perspectives how the RCVS was viewed from the perspective of staff, from registrants, whether that be veterinary surgeons or veterinary nurses, from practice managers, and from stakeholder organisations. One of the challenging groups, I think, was to understand the perspective of the public on the RCVS, and so we agreed to look at complainants, which is a sort of very particular subset. I think what was really interesting was the research showed a sort of confusion about the RCVS, what it is about. This organisation that on the one hand is a regulator, but on the other hand also has a sort of or delivers activities as synonymous with being a royal college, and how those two things fit together. Okay, the recommendations cover a number of areas. They cover about the organisational purpose, mission and values. They look at the governance of the organisation, so looking at the governing body and how that works and how it could be made more efficient. They look at fitness to practice and about the possibility of the RCVS having additional powers in that area. They look at education, about the setting of standards and about the registration process. So the core regulatory functions of any professional regulator. I think the biggest challenge the RCVS faces is about being clear about its identity. What kind of organisation does it want to be? What kind of organisation does it want to demonstrate that it is to its external stakeholders? I think for a number of the regulators, they've become much more open and seek to demonstrate much greater transparency within the last 5 to 10 years. So they're doing more work to find out what people think about them and how they perform. They're much more customer focused, so they've got key performance indicators that are around customer focus. And I think that's something that the RCVS has started doing but could extend further. So it's about, on an ongoing basis, understanding how are we doing, how could we do better. And I think the organisation's already shown itself to be open to that. I think it's a huge appetite for change, and I think it's a really exciting time for the RCVS. I think the external stakeholders have said that they want the RCVS to change, and importantly, they want to be a part of that change. They want to be engaged, they want to give their views, and they want to see it through. Staff are really excited about change. I think it's also quite unsettling for them, as it understandably would be, but they reported back that change is already happening in the organisation, and they want to see that taken further.